Hello. Once again, I have some critical issues to discuss with you. Issues that affect each of our 58,000 members. But, as you already know, my English is a bit sketchy. So, to spare you the irritation, I have asked Michèle Boisclair, our first Vice President, to speak to you on my behalf. Thank you.
Hello. As you probably already know from your local union representatives or through the media, the FIQ left the bargaining table on Wednesday, June 30th. At this table, where the working conditions of the 58,000 healthcare professionals represented by FIQ were being negotiated, the Quebec government asked us to accept the unacceptable. Accepting the unacceptable would mean that, as a precondition to continuing the discussions, we would have to accept what had been negotiated with other labor organizations. We could not give in to this demand. Requiring us to accept an agreement with other organizations is the same thing as imposing a decree, because by doing so, the government would be taking away our right to negotiate. Accepting the unacceptable would also mean endorsing rollbacks in our working conditions. It was therefore unthinkable for us to continue. It was too high a price for the FIQ member to pay. But we also believe it would be too high a price for the people of Quebec, who would no longer be able to receive the quality care they deserve from our public healthcare system. The last government offer presented at the bargaining table last Wednesday evening essentially repeated the agreement made with other labor organizations, even though this same offer had been rejected unanimously by the FIQ delegates the past June 15th. For months, we have tried to hammer home the message to the government that if we maintain the current everyday working conditions of nurses, licensed practical nurses, respiratory therapists, and perfusionists, the entire Quebec healthcare network will collapse. Not only doesn't the government want to put solutions in place to improve the working conditions of healthcare professionals, but is daring to propose the unthinkable, offering rollbacks that would make these unbearable working conditions even worse. The consequences of the government's offer are crystal clear. The government is telling all healthcare professionals that they will have to continue working compulsory overtime, continue working 16-hour days several times a week, work side by side with a growing number of professionals from the private sector, continue to hold jobs with part-time status, and continue to be exhausted physically and mentally. In short, the government wants to continue squeezing the lemon so that healthcare professionals give even more, when and how the government sees fit. If the FIQ were to accept what the government put on the bargaining table, this would mean that in another few years there would be no more professionals to provide health care. And if there aren't enough healthcare professionals, the Quebec public healthcare system will be history. We must continue the struggle in the weeks and months ahead. The mobilization of the FIQ's 58,000 members must continue. It is important to follow the action and the mobilization plan we have established. If you haven't already done so, I encourage you to sign the online petition launched by the FIQ on June 22nd at www.appuyonslafiq.qc.ca. I also encourage you to ask people from your circle of acquaintances to sign the petition as well. The struggle we are now waging is a collective challenge, and ultimately, the survival of our public healthcare system is at stake. Its survival depends on improving the conditions of employment of the professionals who work in it. This government, which is intransigent towards us, must listen to reason and hear the message from the people it represents, the people of Quebec, including the fixed 58,000 healthcare professionals. Finally, have a great summer, and remember that solidarity is the key to success.
In closing, I wish you all, or at least those of you able to do so, a happy summer vacation. Take the time to recharge your batteries and enjoy being with your loved ones. Because we know all too well that in the coming year, you won't be able to do so as you should. Thank you and have a great summer.